In this installment of Best Doctor PCMH podcasts, Dr. Jenene Washington, pediatrician and medical director at Baltimore Medical System, will offer tips for increasing efficiencies of medical staff, nurses, and physicians.
The front office staff will change. They'll definitely have a different role with communicating with patients. Their role would no longer simply be to remind patients of their appointments and check patients in for appointments, but they will coordinate with the back office or the clinical team to understand what the needs are of the patients for their appointments. They can really help with pre-visit planning if they're doing pre-visit telephone calls to remind patients of their appointments. They can also request that patients bring in any additional medications that they're taking, bring in any discharge summaries from hospitals and or emergency departments. So the front desk staff can enhance the role from just being an appointment reminder, check-in process to really understanding the needs of patient appointments and assisting the clinical staff with those needs. The nurses really can provide the cornerstone of patient-centered medical home care management and care coordination services. Nurses will no longer be task-oriented. They will be outcomes-oriented. So they will review the physician or the provider's treatment plan and help the patient work towards those goals. They'll be the main ones responsible for patient education, providing patients with resources to help self-manage their medical conditions, as well as assisting with coordination of care, which is, again, helping patients reach external resources that are needed to help manage their care. So nurses are like a key role for the care management, care coordination, and patient-centered medical home processes in every organization. For the physician practices and provider practices, the most important part is to really be the key member of the team that helps develop the treatment plans for the patients, help the patients develop their initial goals, and key next steps for what you would like to see with the patient care. The other important part for providers to remember is to really adopt evidence-based guidelines for your practice and to ensure that all providers are utilizing the same evidence-based guidelines per disease processes. This would also help for your nursing staff and your MA staff to understand the needs of the patients even before they come in for their next appointment based on what's required from the evidence-based guidelines.